Knock knock. Hi, how are you?
Good, how are you?
Good, my name's Jack. I'm gonna be your nurse tonight, okay? Just give me 1 second while I wash my hands and get some gloves, okay? Alrighty. Okay, perfect. We're gonna go ahead and get started. Could you verify your first name and date of birth for me?
Tommy Stark, 43099.
Okay, perfect. That matches what I have here in my chart. I'm just gonna make sure it matches your wristband. Perfect, and your MRN matches as well, so great. I'm gonna go over your allergies with you, okay? So do you have any allergies to medication? Any teeth?
No.
Latex?
No.
Environmental?
No.
Food allergies?
No.
Okay, perfect, and that matches what I have here in my chart, so great. I'm gonna go over your vital signs with you now, okay? Blood pressure was 118/70, heart rate 68, respiration's 18, temperature 98.2, and oxygen was 100%. So everything looks great there, okay? All right, do you have any pain today?
Yeah.
Okay, when did your pain start?
Yesterday.
How long, where's your pain located?
My right arm.
All right, and then how long does your pain usually last?
It's there all the time.
If you had to describe your pain, what would you describe it as?
Achy.
Okay, and then is there anything that makes your pain worse?
Moving it.
Anything that makes your pain better?
Aleve.
Okay, have you had any treatments for your pain besides the Aleve? Okay, and then if you had to rate it on a scale of 1 to 10.
4.
Okay, be a 4. Alrighty, so glad you came in. Alright, so patient seems to be in no signs of distress. Body is symmetrical. Do you know what day it is?
Thursday at 2
You know,
o'clock.
okay, when you answered the time too, so patient knows who they are and knows the date and time, so patient is ANO times 3. Great. Alrighty, I'm gonna take a look at your drains, okay?
Sure.
Alright, so I'm gonna take a look at your nasal cannula here, check for any breakdown. Great, no breakdown. I'm gonna check behind each ear. No lesions or breakdown, great. I'm gonna follow the tubing to the wall, check for any kinks. Great, you're on 2 liters, matches what I have here in my chart. I'm gonna take a look at your IV site, okay? Any tenderness?
No.
Okay, no, great. I'm gonna check for, the tubing, make sure there's no kinks. No edema or arrhythmia was present as well. And then your IV matches what you're getting in your chart, so great. Alright, I do not see a Foley catheter, but if I did, I would assess one accordingly, okay? Alright, so now I'm gonna do a quick assessment of your hair here. Alright, hair distribution is even. No breakdown, no lesions, great. I'm gonna check your skin out, okay? Perfect. Do you have any wounds that you know about? Okay, great. Looks to be no wounds, no breakdown or bruising. Skin is warm to the touch, and skin color is normal for ethnicity. No edema in any of the extremities, so great. I'm gonna check your skin trigger, okay? Perfect. And then I'm gonna grab each finger, each toe. Each toe. Okay, great. And then gap refill was less than 2 seconds in all areas, so great, okay? Alrighty, I'm gonna take a look at your ears now, okay? Perfect, no obvious drainage, no breakdown or lesions. Okay, great. I'm gonna do a quick assessment of your eyes, so will you go ahead and separate your face from me just like this? Alright, great. So I'm gonna shine some light in your eyes, okay? Try this in each eye. Okay, one more time. Okay, same for the other eye. Alrighty, great. You can let go. And then just go ahead and follow my pen light, okay? Okay, once more. Alright, perfect. Pupils are equal, round, reactive to light, and reactive to accommodation. Sclera is white. Can you go ahead and pull down their eyelids for me? Okay, perfect. Conjunctiva is pink and moist, so great. I'm gonna take a look at your nose, okay? Alright. Area is nice and pink, no lesions or breakdowns, so great. Go ahead and open your mouth nice and wide for me. Okay, perfect. Area is pink and moist. No redness, sores, or lesions. Uvula rises to midline, so great. And then just smile for me. Okay, perfect. And then the face has facial symmetry, so great. So everything seems to look good there. I'm gonna do a quick assessment of your lungs now, okay? Alright, so patient seems to not be using accessory muscles to breathe. Are you having any trouble breathing? Okay, great. So patient seems to be in no signs of distress while breathing, and breathing is non-labored. I'm just gonna go ahead and take a quick listen. So will you turn this way for me just so we can all see?
More?
No, this should be good. Alright, so whenever you feel my stethoscope touch your skin, just go ahead and take a deep breath, okay? Great. Alrighty, so breath sounds sounded good. No advantageous sounds heard, so everything sounds great there. I would teach the patient how to use the inceptospirometer if we had one, and I would have them demonstrate their use for me. Okay, so moving on, I'm just gonna move on to your assessment of your heart, okay? Alrighty, so I'm gonna palpate your carotid. Okay, so, okay, great. Okay, great, and then I'm gonna palpate your radial pulses for me.
Sorry, I'm trying to work.
It's okay, I can work around it. Okay, great, and then your pedal pulses. Okay, great, and then no thrills noted in all areas. Alrighty, moving on, I'm just gonna go ahead and listen to your heart now, okay? I would palpate the PMI at the 5th intercostal space mid-clavicular line, and then I would note if there were any lifts or heaves, okay? But I'm gonna go ahead and actually listen to your carotid first. I'm gonna listen to one side at a time, okay? Okay, great. No roots noted. So everything sounds good there. And I'm gonna go ahead and osculate your heart. I'm gonna do each area of the heart with my diaphragm and bell, okay? So I'm gonna start at the aortic, right sternal border at the 2nd intercostal space, moving on to the pulmonic, left sternal border at the 2nd intercostal space, do Erb's point, left sternal border, 3rd intercostal space, tricuspid, left sternal border, 4th intercostal space, and then lastly I'll do your mitral, your 5th intercostal space at mid-clavicular line, okay? So let's go ahead and do that. Ready? You can go ahead and just lift up your shirt here, okay? Great, everything sounds good. Right in rhythm and everything sounds good. No extra sounds were heard. So everything looks good there. Lastly, we'll just go over your extremities. So are you having any swelling, numbness, or tingling in any of your extremities right now?
No.
Okay, so I'm just gonna do a quick test. Can you grip my hands as hard as you can? Okay, perfect. And then if you wanna lay down and just stick out your, or it's fine, you can just go like this. Alrighty, so go ahead and bring your feet towards your body, okay? Okay, and then press the gas. Okay, everything looks good there, so great. We are done with our assessment. Everything went well. I'm happy I got to assess you today. Do you know where your call light is?
Yeah.
Okay, it's right here. Do you know how to use this guy?
Yeah.
Okay, just demonstrate it for me. Okay, perfect. That is down with the side rail is up in the low position. Can I get you anything before I go? Alrighty, someone will be back in about an hour to check on you, okay? Alrighty, great. Have a good day.
You too.
Alright, I'm just gonna go ahead and wash my hands.